and greetings to you all who join us today for the launch of the COVID-19 Healthcare Professionals Initiative, which we will also refer to as the CHP initiative. My name is Rini Simon Khanna, and I'm very happy to be the connector or the medium or the anchor for this very important event. A few months ago, ladies and gentlemen, soon after the global outbreak of COVID-19, a program was set in motion to connect healthcare professionals with hospitals needing their services towards managing and containing COVID-19 cases. Undoubtedly, while the central and state governments have been doing their utmost to meet the unprecedented challenges, we were also facing a shortage of healthcare professional workers across the country. And it was understood that while across the medical community, there are many untapped resources capable and willing to offer their services towards fighting the pandemic, we could help them better by providing these hospitals and other healthcare facilities with a database of available trained healthcare professionals with skill sets that meet the requirements. By acknowledging this gap in the health sector, Echo India, a healthcare nonprofit, joined hands with Naukri.com, a part of InfoEdge, to create a unified platform to connect the two. The COVID Healthcare Professional Initiative that began a few weeks ago already has over 1,400 professionals who have joined. Now, the next step is to connect them with hospitals and other appropriate healthcare facilities. And I should also draw your attention to the fact here that the whole exercise is purely philanthropic and voluntary in intent and solely to strengthen the preparedness and response measure of the nation's healthcare infrastructure. At this stage, do allow me to also share a bit of information about the main organizations that are spearheading this initiative. Echo India is a not-for-profit group working since 2008 towards both building capacity and extending access to specialty care for underserved communities. Under the leadership of its chairman, Dr. Colonel Kumud Rai, and the executive director, Dr. Sunil Anand, today, Echo India has come a long way with 150 programs completed and 56 more in progress as on date. Naukri.com and InfoEdge are internet companies with in-depth understanding of the Indian consumer, internet domain, and run job portals. Both Naukri and Echo have joined hands with the CHP initiative to bring together a group of distinguished personalities, a few of whom you will hear and see today, who are willing to lend their time, their knowledge and resources towards a timely platform or timely creation of this platform. With decades of experience behind them, this eminent board of advisors governed every aspect of the process, ranging from the design and user experience of the website to the advanced algorithms at the back end that factor in multiple parameters to match skill sets with requirements. Let me also at the outset thank and express our gratitude to the select team from Echo India and InfoEdge who have provided the technical and operational capabilities required to bring this endeavor to fruition, and they continue to support us. So today, ladies and gentlemen, we are happy to offer this synergistic collaboration, the COVID Healthcare Professionals Portal, CHP Portal, an enabling platform that offers healthcare facilities to hospitals, telemedicine providers, and diagnostic labs to recruit skilled healthcare professionals who have undergone crucial COVID-19 training before deployment. Now let me just briefly outline the format for today's online event. We will begin with speeches from some key speakers, and then towards the end of the event have time for some interaction with the audience. You can pose your questions and share them in the Q&A box that you can see on your screen, and we'll select a few for our panel to answer. Before we deep dive into the event, a few housekeeping tips that I request you to please follow to enable a smooth event. All through the webinar, members of the CHP team are going to monitor both the chat box and the Q&A box. As much as we would like this to be as interactive as possible and as close to a live event, we are forced to request you to please share your comments and your reflections in the chat box and reserve your questions for the Q&A box. If you do ask a question during the event, please use the Q&A box, as I mentioned, and be sure to include your name and the name of your organization, especially, this is a request that goes out to members of the media because it'll make it that much easier for us to be able to find your question and flag it. When we get to the moderated questions section, which is at the end of the event, I will be selecting questions from the Q&A box, and our expert panel will give answers to them. If by chance your question is not selected, please be patient with us. Our team will do its best to respond to you after the launch. Do bear with us because there are many technicalities that we need to keep in mind for this event to be a great success. You're welcome to engage with the CHP on social media. The Twitter hashtag is #BeatCoronaSaveLives. It's up on the screen right now, so tweet away. Lastly, a reminder that this event is being recorded and will be uploaded onto the portal, which is www.echo.naukri.com. www.echo.naukri.com. Also, we invite you, whether you are actively working today or retired or on a sabbatical, please register as a healthcare professional. If and when there is a requirement from a healthcare facility in your area that matches your profile, you will be contacted directly by them. So you fill up that database for us so that we can get you to be useful to a lot more people. Your time and expertise, remember, will help save multiple lives and make that vital difference in the country's battle against the coronavirus outbreak. So, ladies and gentlemen, let's start the ball rolling by inviting our first speaker, the chairman of CHP Initiative, Mr. Arun Duggal, former CEO of Bank of America in India, with 26 years of experience and currently serving as independent director on numerous company boards and the founder of the Center for Clean Air at IIT Delhi and the Women on Corporate Boards program with FICCI. May I invite Mr. Duggal to please tell us more about the event and also welcome all our guests and participants.
Thank you, Rani. Dr. Devi Shetty, Dr. Arvind Lal, Dr. S. Prakash, Dr. Kumud Roy, Mr. Prasanna, Mr. Hitesh Oberoi, distinguished speakers, ladies and gentlemen. Let me add my personal greetings and a very warm welcome to all of you on this special occasion on the launch of COVID Healthcare Professional Initiative, or CHP as we call it. When we started this initiative a few months ago, we thought that India would be spared from the ravages of coronavirus. But unfortunately, we have had a very serious impact. It is vital that we increase the capacity of our healthcare system, and CHP is committed to contribute to that effort. CHP initiative has had excellent support from Echo India, InfoEdge, Google, and Star Health, and Genesis. We have been very fortunate to have a very distinguished board of advisors. I will briefly introduce them. Mr. Sanjay Gupta is the country manager for Google India. Mr. Hitesh Oberoi is the managing director and CEO of InfoEdge India. Dr. Brigadier Arvind Lal, chairman of Dr. Lal Path Labs. Dr. Colonel Kumud Roy is the chairman and managing director of Echo India. Mr. D.A. Prasanna is co-founder of Prasanna School of Public Health. Dr. Sunil Anand is executive director of Echo India. Mr. Ravi Nath is chairman of RNC Legal. Dr. S. Prakash, Managing Director of Star Health and Allied Insurance. Ms. Prema Sagar is Chairperson of BCW India Genesis. In addition, we valuable advice Mr. Ajit Seth, former Cabinet Secretary, Government of India, and Mr. Angad Rajan, Chief Executive of Tenon Services. The team from Echo, InfoEdge, Google, and Genesis played a major role in this initiative. Please allow me to introduce and recognize them. From Echo, Surajit Chatterjee, Mayuri Mishra, Paramita Das, Karthik Dhar, Gaurav Shangari, Harin Bansal, and others. From InfoEdge, Paradeep Kumar Singh led the technical team with Ajay Gupta and the entire technical support. And Sumit Singh played a major role in communications. Genesis, we were fortunate to have Bhuvnesh Chawla, Swati Arora, and Silki Chandramani. And from Google, it was Bhaskar and his colleagues which played a major role in promoting this initiative. Under the guidance of Distinguished Board of Advisors, COVID Healthcare Professional Initiative is looking forward to making a contribution to beat Corona and save lives. Thank you very much, ladies and gentlemen.
Thank you very much, Mr. Dugal. We will now move on to Mr. D.A. Prasanna, who will expand on the rationale and the uniqueness of the CHP initiative in detail. Mr. Prasanna, for those of you who do not know him, is a public health policy advocate, a pioneer in low-cost diagnostics, a strategic advisor, and an early-stage investor in life sciences. He has worked on ventilator capacity building and has insight on vaccine trials as well as mentors startups. So, Mr. Prasanna, it's over to you for the rationale and uniqueness of the CHP initiative.
Thank you very much, Mrs. Khanna. Dr. Devi Shetty, distinguished speakers, ladies and gentlemen. I was discussing with Mr. Arun Dugal in March this year my involvement in ramping up ventilator production and creating new bed capacity in India. Mr. Dugal spoke about New York's struggle. New York City has beds, but not enough healthcare professionals to treat patients. We anticipated that in the coming months, India will face a similar crisis. We started working on finding medical professionals willing to serve COVID patients in needy hospitals and to create a platform to make all this work. ECO is an NGO familiar with the type of medical professionals who are most valuable to a COVID hospital. ECO is also experienced in onboarding professionals to a hospital. So they became an eminent partner and we were able to invite and convince them. Profiling medical skills and matching it with the hospital's requirement was another key expertise we were looking for. This expertise in depth was available in Naukri.com, an internet company of InfoEdge. Both ECO and InfoEdge gladly agreed for public good to work on a not-for-profit basis. This led to the birth of COVID Healthcare Professional Initiative. Last 3 months, this team has built the digital portal, attracted over 1,400 medical professionals from all over the country. The portal has created an interest in 60 COVID hospitals to register their healthcare professional requirements. Portal has an algorithm to register, match, and offer a short list to the needy hospital. Hospitals selects from the short list. ECHO inducts and onboards the professional to the hospital. Doctors and nurses are made available at no cost to COVID hospitals. In this national initiative, we aspire to provide over 10,000 professionals to treat 100,000 COVID patients in the year. We welcome to the initiative doctors, nurses, hospitals, well-wishers, and look forward to your participation in the initiative. Let us fight COVID and save lives. Thank you.
Thank you very much, Mr. Prasanna. Let me now introduce our next speaker, who is Colonel Dr. Kumud Rai, an armed forces veteran and currently the Director, Vascular Surgery at Max Super Specialty Hospital, Saket, and also the founder chairman of ECHO India. May I invite Dr. Rai to tell us more about ECHO India and its role in the CHP initiative.
Thank you, Rini. Good morning, Dr. Shetty, Dr. Arvind Lal, Mr. Arun Dugal, Mr. Prasanna, Dr. Prakash, Mr. Hitesh, Bhaskar, healthcare professionals, friends and well-wishers of the initiative, members of the media and press, and all participants today. ECHO, Extension for Community Healthcare Outcomes, is a not-for-profit trust registered in Delhi. We work in the field of healthcare and also a little bit in education. Our aim is to improve health in the underserved areas of the country. And we do this by building capacity and skilling the healthcare workers across the country. The ECHO model consists of 4 pillars. First, it uses video conferencing technology to simultaneously connect several healthcare workers at specified time on a regular basis using a hub and spoke model. Secondly, these workers present real-life cases of problems at these clinics or programs, and these are addressed by a group of experts at the hub. Solutions are provided. Thirdly, best practices are shared at these meetings. And fourth, outcomes are monitored using the iECHO platform. This regular mentoring at frequent intervals, weekly or fortnightly, iterative guided practice, as we call it, leads to building a community of practice where complex real-life problems can be solved and capacity building and skilling occurs. We, along with our partners, institutions of national repute like PGI Chandigarh, NIMHANS Bangalore, NITRD Delhi, SGPGI and KGMU in Lucknow, Tata Memorial Hospital, and 39 others, run 59 such programs across the country. Our focus areas include tuberculosis, mental health, hepatitis, cancer treatment and prevention, palliative care, and a few others. We are a signed partner of the Government of India for capacity building in healthcare and have also signed up with 6 state governments to date. Since the outbreak of COVID-19 pandemic, we have conducted, along with our partners who provide technical expertise, over 1,076 sessions of programs directly mentoring 3 lakh healthcare workers. Our aim is to touch 400 million lives in India by end 2025 and 1 billion lives across the globe. ECHO has signed partners across US, Europe, Australia, Africa, Latin America, and Southeast Asia. It has hubs in 31 countries and learners in 129 nations. We are purely a philanthropic, not-for-profit movement, and there is no cost associated with adopting and running an ECHO program. As the COVID pandemic unfolded, we introspected further. What can we, as a social, stroke development organization do for the nation in these difficult times? We are grateful to Mr. Arun Dugal, who suggested this initiative, contributing towards aggregation of healthcare professionals who are keen to fight COVID-19 and to match them with the healthcare facility who needs them. This is a voluntary effort from ECHO, InfoEdge, all our advisors who have spent a lot of time and painstakingly crafted this platform. There is absolutely no cost involved to the healthcare worker or to the partnering healthcare institution. We hope that this initiative will be helpful and will be a strong, small contribution for fighting COVID-19 in India. Thank you very much.
Thank you very much, Dr. Rai, for explaining to us the vision and the need for this venture. We now have Mr. Hitesh Oberoi to tell us more about Naukri's role in the CHP initiative. Mr. Oberoi is the co-promoter, MD and CEO of InfoEdge India, with almost 19 years of experience in the internet industry. He's part of various industry fora and also a founder and trustee of Ashoka University. Mr. Oberoi.
Thank you, Rini, and a very good morning to all of you. Much has already been said, so I will try and be brief. As you probably know, Naukri is India's leading job portal. So if there is one thing we understand, it is the power of technology to connect and match jobs and professionals. In Naukri, we have a database of over 65 million resumes. We have 500,000 jobs on our platform at any point in time, and we work with over 80,000 companies in the country. For quite some time now, we've also in our head toyed with the idea of setting up a portal to enable volunteering stroke community work. It's a very big thing in the US, but in India, students and people don't really give it much thought. Our education system, unfortunately, doesn't encourage it much either. On the other hand, as we all know, there are thousands of not-for-profits in India. All of them want to do good work, but most of them are not able to attract good talent. There are thousands of schools which lack good teachers, old age homes which could do with much support. And while many of them may not be able to afford market wages, they don't mind paying a little for people who are willing to put in the effort. And I'm also sure if we make it easy, enough people may not mind spending a few hours every week volunteering. So when the pandemic struck, Mr. Dugal and I shared notes. We were very concerned with what we saw play out in New York and UK and Spain and Italy. And we were worried that the same could play out here. And given that our healthcare capacity is low, it was even more cause for concern. As a company, InfoEdge, we wanted to do something, but we were not sure what. We helped the government with some PPE equipment, the government in Delhi. We also funded an IIT Kanpur startup to help develop ventilators cheap. But when Mr. Dugal came up with this idea of partnering with ECHO India to set up a portal with Naukri support to connect healthcare volunteers and professionals with COVID hotspots, it just sounded like the right thing to do, and something where we thought we could utilize our knowledge of how these platforms work to make a difference on the ground. And that's why we jumped at it. We jumped at the opportunity. Now, 3 months later, we have the portal up and running. We have over 1,400 healthcare professionals who are willing to work in COVID hotspots registered with us. And with ECHO's help, we've also managed to onboard more than 60 hospitals. And of course, we've managed to open other partners as well over time. And all this was done by Pradeep Singh and his team at InfoEdge, when most of them work Saturdays and Sundays and on sort of at other times of the day to make this happen on the side. Of course, as COVID spreads, the healthcare system in many towns could come under stress. I hope that situation never arises, but we need to be prepared. And if that happens, then I'm sure with the help of various governments and other organizations, through our platform and through our partnership with ECHO India, we will be able to lend a helping hand. It's a long battle ahead, and the numbers are still growing. Till a vaccine is found, we need to do whatever we can. Even if we are able to save a few lives, we would have made a big difference in the end. So that's really the hope. And thank you so much for being here today.
Thank you very much, Mr. Oberoi, for that vital information, I must say. It is worthwhile for us to look at all the tools and technology enablers that we have to help us fight COVID-19, as many regions and countries still struggle with quarantines and lockdowns. So we're really now delighted to welcome on board Dr. Prakash, Managing Director, Star Health, an allied insurance company. He's a passionate medical doctor who now heads a leading health insurance company, which is unusual. After 2 decades of clinical experience in India and overseas, and more than a decade of experience in health insurance. As the MD of Star Health and allied insurance company, Dr. Prakash has made commendable contributions to spear it and its progress through the synergy of 12,000 plus network hospitals and diagnostic centers in India. Dr. Prakash, do elaborate on telehealth and the broad range of technologies and services that provide patient care and improve the healthcare delivery system as a whole.
Thank you so much. A very good morning to all of you. At the outset, as a medical doctor in the health insurance space, I welcome this very noble initiative, a not-for-profit initiative done by CHP, particularly to increase capacity of medical manpower in underserved areas. So I'm very thankful for the opportunity to be associated with this noble initiative. In Star Health Insurance, we have a free telemedicine services to not only our employees, advisors, and customers, but also to the common public. We offer second opinion, medical guidance during this pandemic like COVID-19, and we help them with electronic prescription. So I was very much moved when Mr. Arun Duggal called me and told about this initiative. I'm very glad to be associated, and let us work together and see that how we can take this benefit across the country to reach more and more underserved people. And my best wishes for CHP to be a medium of larger good for the healthcare ecosystem. Good luck.
Thank you very much, Dr. Prakash. Ladies and gentlemen, you've now heard from professionals who are completely hands-on in the field and seen how they are changing lives with their routine work. How and why should any of this matter, you may ask? One good thing that coronavirus has done is to bring everyone together on this panel. No one is unaffected by its impact directly or indirectly. And so it is important for us to share all those experiences. We now have with us a passionate marketer and business leader with 15 plus years of experience across CPG, media and entertainment and technology industries in India. And he currently heads tech, FMCG, auto media and entertainment at Google. Mr. Ramesh Bhaskar, he has a very personal experience that he would like to share with us. Mr. Bhaskar.
Thank you, Rini. And hello to all the panelists and greetings to everyone who's attending this launch initiative. Professionally, as Rini has mentioned, I'm a Googler. Personally, I'm here as a proud volunteer to the ECO CHP initiative, and I'm truly privileged to be helping the initiative get benefits from our nonprofits program. My voice here today, folks, represents many motivated professionals like me volunteering for the initiative. And our only objective is to help it scale. A few weeks ago, Mr. Duggal reached out and shared the initiative, like many others here, and I was incredibly amazed listening to the vision and the brilliant core team behind it. I said, of course, yes. My original motivation was actually at home. My brother, who is a doctor, and my dad, who is actually a police inspector, and both of them were being part of essential services, were helping out while we are all staying home and staying safe. However, on 24th of July, I got a call at around 7 a.m. in the morning from my extended family in Andhra Pradesh that my maternal uncle was very, very unwell. We were told that he may need hospitalization as he developed some breathing issues. We were very worried, but honestly not too much because he was just 52-year-old. And his COVID tests came negative like twice over in the last 10 days. So it was just another hospitalization that may be required. Unfortunately, we lost him on the same day. And the hospital confirmed that he succumbed to COVID and that the tests were in fact false. And the ordeal that my uncle's family suffered visiting hospital to hospital is inexplainable. The healthcare facilities were just broken, and this loss was too big and too personal for all of us to digest. COVID is fatal if not treated in time. And I was struck with the realization that for all of us, as our friends, colleagues, relatives, family are being affected in one way or the other, it's far closer than you think. Fact is, our family is one among the hundreds of thousands who are actually facing the impact of the pandemic every single day. As Mr. Duggal says, and even Hitesh mentioned it briefly, that if this CHP program can save even a few lives, even if it can save one life through timely intervention of healthcare professionals placed through CHP, it's the most meaningful contribution and a proud moment for all of us. I'm sure this will save many, many more lives. And we need many initiatives like ECHO CHP and many volunteers to bridge the gap and help this initiative scale. We're just getting started. And I want to take this opportunity to thank my colleagues, Kanika Jain, Akanksha Agarwal, and Arnavaz Gista, who actually is helping with me in doing our bit. So thank you so much for listening.
Thank you very much, Mr. Bhaskar, for that personal anecdote that you shared. I'm so sorry that you had to lose your maternal uncle. But like I said, it's very interesting and indeed a learning experience for everyone to be able to listen to the voices on the ground and help them if we can in any which way that we could. So we have with us someone who has more than a decade of nursing experience in the operating theatre, in the operation theatre, Ms. Anchal Telan. She completed her master's in hospital administration and today is an educator in nursing and is also involved with hiring, training, and managing nursing manpower. So Ms. Telan, tell us about why the CHP initiative is important to you and your community of healthcare professionals. Anchal?
Thank you, Ms. Rini, and a great thank to ECHO, as well as I really like to say good morning to all the distinguished guests, panelists, and the audience. And on behalf of all the nursing fraternity giving me a voice to speak few things about that ECHO can help us. As you all know that COVID has hit all of us in all the corners at a very high rate. And ECHO can help us to bridge that gap of skill and competency. We've seen people dying every day. Since I'm working with a hospital, so I know how hard it is for a patient as well as for the relatives. They can't meet them, they can't talk to them, they cannot feel what the patients are feeling. So as a nurse, the responsibility increases. Our frontline warriors, that is our nurses, are really working hard to fill those gaps, are trying their best to understand this infection, to understand this disease, and to help the patients. Plus, they are risking their life. We have so many examples. Rini, I must tell you that I would like to share with everyone that there are many nurses who cancel their leaves to come and work. There are many volunteers nurses that we have. They forget about their family. They don't even go and visit their family. They stay in the hospitals. We have the accommodations for them. And the initiative like ECHO actually can bring the need and the needy to nearer. The initiative that they have launched is really hats off, so that we can have more manpower, we can have more skilled manpower, and we can bring the privileged people or the people who are of like mindset all together. And I really thank Mr. Duggal to giving me an opportunity and to get in touch with me to be able to speak on that and to give few points on that, what a nurse feels. And I know the time constraint is there, but there are a lot of things that happens at the healthcare setup or inside setup. And yes, recruitment is on a hold because since I'm responsible for recruitment, so we are on a hold. But we need people who actually can work with our patients. So, and for me also, ECHO has given me a chance to speak up, and I strongly believe that it can also help me achieve my goal. I also want to be a volunteer, but few constraints couldn't help me. But there are people whom can be more of a help, and we can tackle the situation, we can save life, and we can prevent this COVID, and we will overcome. Thank you, Rene.
Right. Thank you so much, Anshul. Thank you very much, and more power to your community. So as we gather, over the time that we've been listening to various people here, there are numerous healthcare professionals and doctors who all go beyond their call of duty to help with the pandemic across the world. So, ladies and gentlemen, it is with immense pleasure that I now introduce the renowned cardiologist and entrepreneur, Dr. Devi Prasad Shetty, immensely respected for his ingenious ideas of reforms for the healthcare sector. Dr. Shetty's visionary leadership to make quality healthcare affordable for all has drawn global recognition. Dr. Shetty, I invite you now to share your perspectives on how to expand the capacities of healthcare systems to deal with COVID-19.
Thank you so much. Thank you so much to ECHO for giving me this opportunity. So since the time is limited, I would like to briefly talk about various issues. One is the short-term and the long-term planning of healthcare manpower. The first of all, my sincere request to all the healthcare professionals, especially the senior healthcare professionals, to protect the healthcare workers. This is extremely, extremely important. At times we can get carried away. One of our senior intensivists, he was resting off his duty hour, a room upstairs. Then something happened, someone called him and he rushed to the ICU and he attended a patient without a mask, without the PPE. He was obviously dedicated senior intensivist, and a week later he was positive and he was out of action for more than 1.5 months. Now, what is important? Is it important to help saving one life, or being alive and fit and take care of hundreds of people on a daily basis? Because we cannot, in a short term, we cannot have more healthcare workers than what we have. And this battle will last for few more months or maybe a year. We don't know. So it is very, very important that everyone thinks about how to protect the existing manpower. Now, what is the reality? The reality is that when the COVID battle started, we had no idea what we are fighting with. We had absolutely no clue about what the enemy is, what the enemy's strategy is, because it's only a 6 months or 8 months old, hardly 6 months old disease. So we did our best, and hats off to the government hospitals. They did a fantastic job in the phase 1, taking most of the brunt. Now, government hospitals, government doctors are tired, fatigued, and they're burnt out. Now the entire load is getting shifted to the private sector. And private sector is doing a phenomenal job. Right now we have close to 380 COVID patients in our healthcare, in our hospital campus, 380 patients. And we have more than 80 or 90 in critical care unit. You can just imagine the brunt borne by the private sector now. 130 of our doctors and nurses are infected. So this is the current situation. Now, essentially what is going to hit our country in the next few weeks and months is the acute shortage of doctors, nurses, and technicians. We always read in the newspaper that there is no bed available. There is no bed available in the government hospital or the private hospital. There is enough and more beds, but sadly, beds do not take care of the patients. It is the doctors and nurses who take care of the patient. And that is that's in short supply now and even in the past. So unless we take a very dramatic decision about empowering people who are currently not empowered to take care of these patients, we may land in trouble. I hope and pray to God that we will withstand this onslaught of COVID for a few more weeks or a few more months, But if we are not able to, we have a hope. We can produce large number of workforce by changing our regulatory requirement. First thing is about the nursing. Fortunately, COVID behaves in a more or less predictable manner now, wherein it goes from one city to the other city, one town to the another town. And when one particular city gets bombarded with COVID, gradually over a period of time, it reaches a plateau and the number comes down. So these towns and cities require a maximum number of assistants when the problem has hit the peak. So we need a fluid workforce of at least 1 to 1.5 lakh nurses and at least 50,000 doctors. These doctors should be young. They should be technically skilled to manage a patient in the ICU. It's totally unfair to send qualified MBBS doctors who have never worked in the ICU first time to a COVID ICU. Leave alone them being helpful to the patient. They are a liability to the institution and to themselves. So we cannot make those things happen. It's not like this is the very unique time when the healthcare workforce have to take care of their life more than the patient's life. So it's a different kind of a mindset we need to have. We believe that the young doctors, young nurses are ideally poised to take up this job. Now, if the government decides that the nurses who have finished their 4 years of BSc or 3 years of GNM, who are waiting for their exam, if the Nursing Council and the Health Ministry decides that they don't need to appear for the final, what is exam after all? They finished their training. They're not going to learn anything in exam. It's just a certification. If they are told that you don't need to appear for the exam, but you all should commit to work in a private or a government hospital managing COVID patients for 1 year. Believe me, we will have, even if there may be about 1.5 lakh nurses, even if 70,000, 1 lakh nurses volunteer to work, it's a huge workforce. And this is what was done in many countries. And why can't we do that? The other important source for the doctors, we have over 25,000 doctors. In the final, they have finished their postgraduate training in general medicine, in pulmonology, in anesthesiology, all these specialties, under MD or DNB courses. Now, if they are all told that this year there is no exam, you all have passed, provided you work in the government or a private hospital for 1 year. Even if half of them volunteer to work, we will have a very strong workforce. So this is something we have the option which we can do it, provided the situation requires it, and I'm sure government is well aware of these possibilities. The other important changes we need to do is to use the technology. Today, when a patient is in the COVID ICU, nurses have to go every few hours, check the blood pressure, check the pulse rate, check the temperature, check the respiration. All this can be automatized. All we need is a telemetry device, which hardly costs some 20,000, 25,000 rupees. You attach to the patient. It can continuously give the saturation. It can give the ECG with the analysis, and it can even calculate the risk score. These technologies are available. So nurses need to touch the patient should be brought down significantly. And nurses need to touch the patient only if they have to do a procedure on the patient. Supposing the patient his position has to be changed, he should be ventilated, then it is inevitable. But just getting the data from the patient, pushing the nurses to do it, I feel with the technological tools, what is available, we can address it. And also other advantages with the data coming from these machines, senior doctors who are not supposed to enter the COVID ICU can still sit in the comfort of their house and manage hundreds of patients in remote locations. So about the long-term plan, the COVID has given a very clear message that we have to address the shortage of doctors. Now, as you know, medical college costs 400, 500 crore rupees to build and over 150 crore rupees to manage. Is it really required for this investment? So all we have to do is double the intake of the existing medical colleges. We have over 500 medical colleges. If we tell all the medical colleges, instead of taking 100 students or 150 students per year, you take double the students. And the preclinical education should happen in the existing infrastructure. They got 20 acres of land, massive infrastructure. They can easily train double the number of students. And each medical college should adopt one of the government hospital. Especially there are 740 district hospital. Each medical college can adopt one of the district hospital and convert it like a medical college. So one medical college with 2 campuses can easily double the, instead of taking 60,000 students per year, we can take 120,000 students per year at very little infrastructure cost. Thank you very much for the opportunity. I'm extremely grateful to Prasanna and the ECHO for making it happen.
Thank you so much, Dr. Shetty. You know, by now, of course, you know that, but you do remain an inspiration for thousands of patients and medical professionals across the world. And you've raised such pertinent points in your short address to us. Thank you for the work that you do, and I hope that you will remain with us for the interactive part that is going to follow very soon. Finally, we have Dr. Arvind Lal, Chairman and Managing Director, Dr. Lal's Path Labs, a pioneer to bring laboratory services in the country at par with the Western world, an alumnus of the Armed Forces Medical College, Pune. He today mentors FICCI's Health Services Committee and is its outgoing chairperson. May I call upon Dr. Lal to please make the concluding remarks. You need to unmute Dr. Lal. Yes.
Sorry. Thank you very much, Rini, and thanks a lot, Dr. Devi Shetty, for again reiterating the points, and that is the healthcare professionals always come first, and they have to be protected, and we need them in large numbers. He has told you, and he's been talking about this for many months, if not years, I think, and that is to put the training or production of the healthcare professionals and the specialists also on a fast track. I'm delighted to be a part of this launch program for COVID Healthcare Professional Initiative. I've been a part of the discussion for this initiative for quite some time as a board member of ECHO, and ECHO India that is, and because of my personal conviction that we need this initiative to contribute in expanding the capacity of healthcare systems to fight this pandemic. I'm very proud of ECHO's excellent work, especially because its leaders are my former colleagues from the Armed Forces Medical College, namely Dr. Sanjeev Arora, Dr. Kumud Rai, and Dr. Sunil Anand. And I have all just mentioned to you what I 100% agree with what Dr. Devi Shetty has said about the manpower. To just give you another perspective, we are short of nearly 10 lakh doctors right now, 20 lakh nurses, and about 30 lakh paramedical personnel. So that's what India is facing right now. I especially take this occasion to thank Dr. Kumud Rai, Mr. Prasanna, Mr. Hitesh Oberoi, Dr. Prakash, Mr. Ramesh Bhaskar, Ms. Aanchal Tehlan, and Ms. Rini Simon. And last and not the least, my dear friend, philosopher and guide, Mr. Arun Duggal, who has spearheaded this program. Without his thinking about it or actioning it, this was not possible. Mr. Duggal, thanks once again. All of them have pointed out to the fact that this initiative is working on solving a very important problem the country is facing. Healthcare workers. I must, one second. So healthcare facilities have no easy access to them, as you know, and this has got to come in the form of a CHP, which we have all talked about. And this is the medicine coming, joining hands with the technology people. And there are many experienced, well-skilled, dedicated healthcare professionals, as you know, in our country who are willing to serve the COVID patients, but our healthcare facilities have no easy access. So CHP can help change all that. And we can ensure that the system, which has been set up by Naukri.com, InfoEdge, Genesis, and to match these professionals with the demands of the hospitals and healthcare facilities, are working efficiently and expeditiously. I am truly grateful again to Google for spreading the word about this program and Star Health for its telemedicine programs. I must say today's launch is just the beginning. The real work will start now, and that is to enable more and more healthcare professionals to contribute in the fight against this scourge, COVID. I am confident that with our concerted efforts, India will be able to bend the COVID curve finally. But we must further use this program to ensure equitable availability of healthcare workers in underserved rural areas. In our discussions with Mr. Rajesh Bhushan, Secretary, Ministry of Health and Family Welfare a few days back, to improve primary healthcare in this country, we spoke of shortage of trained manpower in remote areas. With the blessings of Ministry of Health and Family Welfare, this CHP COVID healthcare professional program can also be modified, or what we say tweaked, and leveraged to staff the 1.5 lakh health and wellness centers across the country, the staff in them. To conclude, I will once again highlight the objective of this initiative. It is to serve COVID patients by connecting dedicated healthcare professionals with healthcare providers all over India. And thank you very much once again for your presence and your support. Thanks.
Thank you very much, Dr. Lal. Well, we've almost come to the end of the launch ceremony. I'd like to thank all of them who have contributed and offered valuable suggestions, in particular our esteemed speakers and panelists. Building on those reflections, I'd like to now carry forward this discussion with some questions to the panel. And we'd like to take on as many questions as possible. We have about 20 minutes. So put those questions into the Q&A box if you haven't already. Add your name and the name of your organization to the question that you're asking. So our first question, I'd like to pose this to Mr. Arun Duggal. Mr. Duggal, very briefly, if you could tell us what was the real motivator to set up the CHP initiative?
Thank you, Renee. We have two daughters. Both of them live in New York. And as you all probably know, a few months ago, New York was so badly hit by COVID that we were extremely concerned about that. I read a story in New York Times that a woman from Findlay, Ohio, a nurse, came to New York City to offer her services as a nurse. But the health system there was not set up to accommodate and take volunteers like her. And she had tremendous difficulty. She had to go through an agent to find a spot for herself in a hospital. And that's when I started thinking that should such a situation arise in India, how will we cope with it? And that was the starting point when I started to speak with Dr. Kumud Roy and Hitesh Oberoi in trying to put it together.
Thank you very much, Mr. Duggal. I'd like to now include some of the questions that we have from the audience with us already. And this question actually goes out to Dr. Rai. Are the healthcare professionals registered on CHP portal trained in COVID care by ECHO or any other body before matching them with a hospital? This was a question raised by Ranjini Madhavan from the New Indian Express. Dr. Rai?
As part of this CHP initiative, after the matching and once the healthcare workers is going to be onboarded to a new institution, Echo India would provide online training to that person on two things, a little bit about the COVID disease and what Dr. Devi Shetty pointed out, how to be cognizant and alert at all times to prevent you falling victim to it while doing your best, because they need to protect themselves while they are doing this job. So it is, if in the charter of our duties, if I can put it that, or in the flow, that before a person is onboarded onto a new institution, he will undergo training by Echo India experts and other experts on how to manage some idea about COVID, some idea about personal protection, and some idea about the new institution he's going to. Thank you very much.
Thank you, Dr. Rai. There are lots of points that have been raised by our professionals here today, but I know that a lot of you will still be curious as to how we can leverage this pool of trained medical and paramedical personnel in India to effectively tackle the COVID-19 pandemic. Perhaps Dr. Prasanna, if I could bring you on board here, perhaps you could answer that question for us. How are we going to leverage this pool?
Thank at the right location and to start quickly, to start caring the patient as early as possible. With experience of ECO and Naukri, we plan to achieve this effectively soon with the cooperation of the hospital where they're posted. We are setting up all these protocols, and I'm confident that we will have this learning curve quickly scaled. Thank you.
Thank you very much, Mr. Prasanna. If I could draw in Dr. Prakash here, since this is your domain of expertise, it would be interesting to know if, in your personal experience, how it has been to use telemedicine to reach the patients who are disadvantaged either because of geography or because of economics. Dr. Prakash?
In our experience, we have found that telemedicine could help a lot of people. In fact, we can extend the services that are available in the metros and cities to urban and rural areas through telemedicine services. We address around 20,000 plus calls in a month. And in this COVID pandemic season, we see a lot of people. Most of what, as a doctor, what I see is what they require is a psychological support, a building of confidence, to tell the customer about when an admission is really required, up to what extent they can self-isolate, how they can use a pulse oximeter and understand whether they are comfortable or they are deteriorating. And we can definitely handhold them and help them to reach the appropriate services whenever there is a need. Our telemedicine services started last November, and in this 10 months of journey, during COVID-19, the numbers got 4-5-fold more. We initially started this service to help our customers for medical second opinion and for medical guidance. But during this COVID pandemic, it is helping our customers and the common public in a big way. We are doing it as a 100% free service, because we from Star Health Insurance, we don't look at ourselves as just healthcare financiers. We want to be healthcare reformers. That is when Mr. Arun Dugal came and told me about this proposal, I was very much moved by his gesture. And I can ascertain that we are going to be with CHP and offer the best of our services to see that how we can utilize a manpower who are interested and who have the basic knowledge to communicate and answer our senior citizens with non-communicable diseases or people suffering from COVID-19. We can utilize those resources in the best possible way. And also we can share our telemedicine services in any way CHP wanted to reach the common public.
Thank you very much, Dr. Prakash. Well, ladies and gentlemen, world over, we are still struggling to learn how to handle this pandemic. If I could bring Dr. Shetty here, we have a lot of questions for you, Dr. Shetty. And with your low-cost, high-volume business model that has been so effective where you're practicing, I wonder if you could just list out for people who are joining us a little later, if you could just list out for us how you could help the existing healthcare infrastructure that we have in our country and how this can be leveraged in a more efficient manner. I'm sure that you have it at, at the tip of your fingers, because you, in your address, addressed many of these issues and practical solutions that you had with great insight to offer to us. Dr. Shetty.
Let's leave behind the historic circumstance. Let's talk about the current and the future. The private sector offers nearly 70–80% of the healthcare needs of the country. Now, a country like India, which is, first of all, we should accept the fact that we are not a rich country. Because the moment you think we are an affluent country, the whole dynamics changes. We are struggling to survive. We have a lot of limited means of essentialities. The cross subsidy is the only solution for affordable healthcare to everyone. Now, government strongly believes in cross subsidy. The farmers pay nothing for the electricity because people living in the city pay a huge amount of money to the electricity. Now, if the common man, working class, poor people can access healthcare in private sector, government should fix the percentage of beds for this category of people in the private hospital, but do not disturb the market forces which fix the tariff for the affluent, wealthy people. The moment you start disturbing the dynamics of fixing the price for a millionaire who wants all the comforts in a super deluxe room, which hospital do provide, who will pay the premium and the money what you can generate, you can subsidize 10 more patients. If you clamp the price of what he will pay, believe me, you have an unsustainable model. We already have an unsustainable model. Virtually every hospital in the country is broke. They have no money. They have no money to pay the salaries. With this kind of a backdrop, the cross subsidy is the only means, and whatever we have done in other services, we should try to enforce it even in healthcare. This is the only suggestion I have.
Right, thank you very much, Dr. Shetty. I have a couple of more questions for you. There is one from a special correspondent with the Times of India, Lucknow. Shelvi is her name, and she asks, Dr. Shetty, please elaborate a little more on countries which have done away with final exams and have made nurses take charge of work. If you could just answer that first, and then I'll come to more questions.
I wouldn't be able to get the data right now, but I know that in England, the final year medical exams were exempted in quite a few universities. And in Italy, they did the same thing. In Italy, they even went to the other extreme of getting other medical professionals to come in. So essentially, these are the two countries I know of reading the document, but I'm sure there are many more countries.
Okay, there's another one here from Milan Sharma from India today, and he asks, have we already reached a shortfall on doctors and healthcare workers? How many doctors, nurses, medical staff are required in a COVID-19 dedicated hospital in today's scenario? So on an average, what is the shortfall is his question.
You see, we reached the shortfall at least 30 years ago. Right? Today, we are desperately, as Dr. Arvind Lal was quoting, we are desperately short of at least 1 million doctors or maybe 2 or 3 million nurses. This is the shortfall, because if you go through the government data of vacancy in district hospital, government hospitals, it is nearly 80% shortage of medical specialists in government hospital. Right? So the private hospital share the specialist, so you don't see that figure standing out prominently. So we are extremely short of medical specialists. So there is, the COVID has only worsened the need. Let's look at the COVID patient require a critical ICU care. ICU care, the ventilator. In this country, legally only anesthetists can put a patient on a ventilator. There are less than 40,000 anesthetists in the country. Half of them are past the age of 55, 60. They may not be able to anesthetized. So you have the services of only 20,000 people. So if you are going to think about, if you are debating, whether we really have a shortage, this is the data. And this is what we have to believe in. So similarly, the nurses, we have a phenomenal shortage of nurses. And it's been going on for a long, long time. What puzzles me is a country which produces 26 million babies a year. Why are we still struggling with the short? And every year for 50,000 medical seats, 10 lakh students apply, right? So with that kind of a ratio, I still can't figure out what are we missing.
Yeah, that is a question. That's quite a deep question, Dr. Shetty. I'd like to bring in Dr. Lal here now. Everyone is very keenly watching that space for the panacea to the COVID-19. Is it possible for you to throw some light on the vaccines that are being tested? And how soon do you see them being introduced in India?
Yes, Rini, there are actually, what is now very well known is there are 300 companies or organizations working on the vaccine, out of which 100 are pretty, much serious about it. And out of these, 10 are, way ahead of the others. And as you've heard in India, we are to be manufacturing a vaccine, which is by the Serum Institute of India, which has been, researched and produced by Oxford University, and the the pharmaceutical company, which has now given certificates, or we can all produce it in India, and about 10 crore dosages are going to be produced here in the first instant. And this company, that is Zydus, the name just escapes me right now, of the British company. So they have, now they'll be going all over the world. Number two, the Indian company Biotech India also is pretty much ahead. But coming to your question, that when are we going to be seeing it? Well, not before the end of this year. Next year, you will have probably many more, vaccines coming in, definitely in 2021. And this scope, the whole scenario is going to be changing. I think, I have a feeling, definitely by the middle of next year, when each person, who needs this vaccine would be vaccinated. That's what I have to say right now.
Well, thank you very much. I hope that all that you said comes true. We couldn't require the vaccine, faster, if you may. If I could turn to the specifics of our initiative today, and for which we are here, and I could turn to Mr. Oberoi. You talked of, in your speech, you talked about Naukri's role in the initiative. I'm very curious to know how you're going to match this database of healthcare professionals with the areas where there is a greatest need for them. Mr. Oberoi?
Yeah. Already the Naukri technology team over the years has developed various algorithms for matching qualifications and skills between requirements and professionals. And we do this at scale, like I said, we work with 80,000 companies. We have 65 million resumes, 500,000 jobs on our platform. So we'll be leveraging a lot of these learnings, which we have sort of gathered over the years. Apart from this, we are using two more important factors for this particular initiative: location and language. We are trying to match professionals from nearby locations, where the requirement is. At the back end, we have the ability to tweak the location range to say within a few kilometers of the hotspot, for example, or the state. Or so if there's for example, if there's a big problem in Meerut, we could sort of try and get professionals from Delhi to go to Meerut, because Meerut is close to Delhi. Similarly, we also capture language with which the medical professionals are familiar. As you know, for example, there are lots of nurses from Kerala in Delhi, for example. Now, if there's a pandemic, if the pandemic situation worsens in Kerala, you need people who understand the local language. So we could actually reach out to nurses in Delhi and sort of move them to Kerala if required. So stuff like that. So, we are sort of doing a lot of things in the background to match requirements with the information we are collecting from healthcare professionals. And of course, after that, we pass it on to ECHO. And then ECHO takes it up with the respective hospitals.
Right. Thank you very much, Mr. Oberoi. We've got a question for Mr. Duggal now. This is a rather long question, but I'll take this. This is from Suraksha of Deccan Herald. What is the role of Echo India and CHP initiatives specifically to providing Bengaluru and Karnataka hospitals with healthcare professionals? Who are these 1,450 professionals who have registered? Are they doctors? Are they nurses or paramedics who have lost jobs during the pandemic? Or are they professionals who've just completed their graduation or their post-graduation in medicine and are working to look for hospitals? Mr. Duggal?
Thank you. On the database, the professionals who have registered are largely doctors, nurses, and healthcare technicians. Their experience range is wide, and they're also in various geographies. The largest numbers of registrants so far are in Maharashtra and Delhi. There are professionals who have registered in Bangalore and Hyderabad, Chennai also. But I must say, we are just starting. This launch is the starting point. We hope that this 1,400 will become 2,800 in a few weeks' time. And our goal is to go to 10,000 of these professionals who will be available all over the country.
Wonderful, Mr. Duggal. I have a very interesting question for you, which has come from Singapore. This is Dr. Anand Govandalaru. I hope I'm pronouncing his name right. First of all, congratulations for the launch of the CHP, an important platform for India, he says. His question is whether you could extend this to other countries. And if so, he's very keen because he's based in Singapore and he'd be happy to volunteer.
Thank you. A very good question, something we've been thinking about for some time. When we started to identify which way can we solve this problem, we looked around. We looked at the US, Europe, other countries, and we could not find a solution like this anywhere. And as we developed this solution for India, we also talked to Echo in the US. Dr. Kumud Roy spoke to them. And we thought of where else can this be used? Africa is one place where this could be used. And basically, we just wanted to wait for a little while, make sure that our system is working, make sure any bugs that we have in that system are taken care of. And then we will like to offer it to any country which can take advantage of that. And I'm sure many countries can take advantage of that. And we'll provide this platform free of cost to any country.
Wonderful. I think you are following the philosophy of sharing is caring. So we hope to be able to extend this to far more people than we have on the platform today. There is another question from News Today Chennai, Gyana Pragasam, who asks, and if I could have Dr. Rai respond to this, are healthcare professionals insured for their lives from your side? So a technical question, Mr. Rai, Dr. Rai.
The short answer to this question is no. At this point of time, we are not taking any responsibility for insuring them. But as the larger goal of the government that healthcare professionals and everybody should be insured against COVID, we will be to facilitate that. And that would also be part of our training initiative, which would take place in COVID to advise the healthcare professional to help him actually get that insurance. And we are very fortunate to have Star Health as our partners, and they will do that expeditiously.
Okay, I'm going to move into technology a bit now. We've got a question here which is, on the aspect of using technology to our advantage. And you know that Google and its parent company Alphabet have really moved away from just being search engines and are now focusing on the actual practice of medicine as well, with artificial intelligence being used. So in such a scenario, how can technology help combat this pandemic across the world. And maybe Mr. Oberoi or Bhaskar could respond to this. Hitesh, would you like to take this on first?
Okay,
We're having a problem with your audio. Bhaskar, if you're available, can you answer this?
Can you hear me, Rini?
Yes, yes.
So I think I would like to contextualize the current support that we are actually helping CHP with in context of having them enrolled as a part of our Google for Nonprofits initiative, which focuses primarily on spreading the word at this point in time. And yeah, I think Hitesh should be in a better position to kind of share the next step.
Hitesh, could we have you back on?
sorry, let me try again. Am I audible now?
Yes, yes, you are.
Okay, so, we are, of course, doing our bit. We are trying to connect professionals with healthcare organizations, but technology is being used everywhere and in sort of many different ways. For example, all of us are familiar with the Arogya Setu app, that's being used for contact tracing. Technology companies are working on getting vaccines to market faster. There's a lot of sort of stuff which is happening. People are trying to sort of use machine learning and AI algorithms to see if they can get drugs to market faster for COVID. We don't know whether it's going to work out, but they are trying to use these algorithms to shorten the time it takes to sort of get some of these things to market. So a bunch of people are trying in different ways. I hope some of these initiatives sort of work out for everybody.
Okay, my team has been keeping a close eye on the clock, as it were. We've exceeded our time, but I'd like to bring in one last word from Mr. Duggal. I know that today is the launch of the initiative, and so everything is very, very new. But I know that you've also had very good responses and reactions from healthcare professionals and hospitals. Would you like to share some of those with us, Mr. Duggal?
I think the most common thread that I found very satisfying was a sense of passion and dedication. That this is not a job. This is something I'm doing with passion from my heart, and I want to make a contribution. And those are the people who have come forth. Those are the people, we would like to get more people like that. And that's what this launch event is for. Help us connect with those people who want to take part in this noble pursuit and offer themselves and make themselves available to fight COVID and save lives. Thank you.
Thank you very much, Mr. Duggal. Yes, you've highlighted the point of volunteerism. This is a movement that needs to be kindled and rekindled and kept alive across the country for all sorts of calamities and problems that we face. So sadly, we've almost come to the end of our allotted time. A very special thank you to all of you for participating in large numbers and contributing to the launch of the CHP initiative. Gratitude to the CHP team, to ECHO India, and to Naukri, with whom this launch was done in partnership. As I take your leave, I'd like to encourage you to visit the portal echo.naukri.com and engage with the CHP team via social media. Use the Twitter handle and join the conversation. #BeatCoronaSaveLives. So healthcare professionals, a special shout out to you. Do network and share the news in your community for more people to register on this portal. A special request to members of the press, please join our effort in trying to spread the word on the initiative. Write about it, talk about it, and use all tools that are available at your end to reach out to more people to reinforce our efforts to fight COVID-19 jointly. Lastly, a big thank you to Dr. Shetty, who has taken time out of his busy schedule to join us today and add his expertise and excellence and brilliance to this effort. Thank you very much, ladies and gentlemen. We take your leave, continue the conversation on the portal, and use the Twitter hashtag. Thank you.